Will you be able to breastfeed after a breast implant surgery? Hi everyone, I'm Dr. Mansi Dhende. I'm a board certified plastic surgeon and I'm currently practicing in New Delhi, India. So in today's video, we'll try and understand whether after a breast implant surgery, you will be able to breastfeed or not. So in a breast implant surgery, as you may all know, we use silicone breast implants to increase the size of your breast, to improve its shape and also symmetry. In a breast implant surgery, there are various placement options that are available. We can either place the breast implants just below the gland, that is a subglandular approach, or below the fascia, that is a subfacial approach, under the muscle, submuscular approach, or dual plane, in which some part of the breast implant is below the gland and some part of the implant is below the muscle. For all these approaches, we make an incision in the inframammary crease and then create the pocket in which we want to place the breast implant. Now you have to understand that when we are making this pocket, we are not damaging the milk ducts or the breast gland. Therefore, the chances that your breastfeeding will be affected because of a breast implant surgery are nil. After breast implant surgery, you will be able to properly breastfeed and your breastfeeding ability is not going to be hampered in any way. Having said that, you also need to understand that there are various incisions through which we can place the breast implant. So there are three incisions that are commonly used. One is axillary incision, the other is a periareolar incision, and the third is the inframammary. Now, if you're using the inframammary incision, which is the most commonly used incision, in this the chances of affecting or damaging your breast gland, milk ducts are nil, because we are not incising the breast gland at all in this incision. But in case you plan to undergo a breast implant surgery through a periareolar incision, then in that case some of your milk ducts and breast gland will be incised. Therefore, this incision is not the one which is very popular. What I personally prefer and most of the plastic surgeons prefer is an inframammary incision. Through this incision, we can make a pocket safely without damaging your milk ducts, your breast gland, and preserve your breastfeeding capacity. So if you're someone who is planning to undergo a breast implant surgery, but you are worried that after a breast implant surgery, your ability to breastfeed is going to reduce, then I want to assure you that this is not going to happen. After a breast implant surgery, you will be able to breastfeed properly. If you have any further questions regarding breast implants, breastfeeding, or any other plastic and cosmetic surgery procedures, please feel free to reach out to us. We'll be happy to answer your questions.